welcome to today's Wednesday webinar. It is great to see so many of you are here. Today we are doing a bit of a question and answer session, but rather than it becoming a big kind of rowdy noise, we've had questions pre-submitted. We've got 7 questions we're going to go through, but equally, if you have other questions that you want to ask, please do put them in the meeting chat. We have muted your microphones and made sure your cameras are off just to make sure everything runs smooth, but you can still get in contact by hitting that chat button, which is at the top of the bar here. So, welcome. My name is Louie. If this is your first webinar, a very, very warm welcome to you. These really are about keeping people informed, ensuring that services feel that they have a good understanding of CQC and what's kind of happening and what's around the corner. We typically do these every fortnight. As I mentioned just a moment ago, we won't be doing them over August. This is because, A, we expect CQC are going to be not doing a huge amount over August. There's not going to be a huge amount to share. But also, I will be in Canada, which sounds amazing, but it is not, because the town my wife comes from in Canada is rubbish. So I'll be having a rubbish time in an amazing country, and I will be in the rubbish bit of that amazing country. Most importantly, I'll be 5 hours behind, so it could be a bit tricky to do some of these webinars over August. If CQC do a massive release or a massive change, then we will, of course, get one set up and everyone will get an email for that. But assuming that CQC don't do much over August, we won't have the webinars, but then they'll kickstart again in the first or second week of September. We cover a wide range of topics, but particularly a focus on CQC and compliance. So what we've got for today, we've got a Q&A, and there are 7 questions we're going to go through. These questions have come a mixture from kind of online, from our kind of our form and LinkedIn and so on, but also from some of the conversations we've been having during our training sessions too. We are going to also be looking at any questions that you have. So please do use that chat function if you want to raise a question. So very first question, and one that we get asked a lot and was asked again: when will the portal work properly? So, as many of you will know, the CQC had their CQC portal, which was essentially supposed to be a way for services to submit evidence and upload evidence. It would go straight through to CQC, they can review it, and it would be this kind of magical portal that would handle the whole of the CQC to care provider conversation and journey and evidence sharing. When the portal was launched, it already started a bit rocky, end of 23, early 24, when it was first launched. Things weren't quite working, not everyone had access to it, and so on and so forth. What essentially transpired over the course of the year and then came to a head when CQC's new kind of chief director was brought in was that actually it was built very, very poorly. CQC had essentially been told that their IT systems were starting to lag and they needed a whole new system. That whole new system that cost a significant, I think the amount was £92 million, or was a significant part of that spend was on the platform. When this didn't come to pass, what's happened is CQC have gone back to their old systems. They've done a few kind of tweaks and changes, and a lot of services are sending their evidence as a result of email. Now, James Bullion, who was the former Chief Inspector for Adult Social Care up until a month or so ago, was very open at a meeting at a conference, I think it was last month, the month before, where he said that essentially it's going to be around about a year from that point. So this would have been in June. So he was saying in June that it'll be about a year until the portal is where it needs to be. So in terms of what that means for services, what it essentially means is that services are still sending information via email. They're still using some of the older systems, and we don't have a quick magic turnaround. The independent report that was done onto the portal confirmed a lot of suspicions, which it wasn't built properly, that it wasn't tested properly, and that as a result of that and other IT issues within the CQC landscape, it faltered and it hasn't worked and had to be withdrawn. They are now actively working on redeveloping, fixing and redeploying the portal. But again, if we're thinking about dates, the closest we've heard is James Bullion last month saying that it would be about a year until the portal will work properly. There is a wider question of will the portal actually do the kind of the higher end aim of people being able to submit evidence whenever they want. CQC are always open that they wanted to get to a point where the portal would result in kind of a more open continual dialogue, but that was not going to be the initial way of using it. You can imagine from a CQC perspective, if they create a portal that enables everyone to submit anything whenever they want all the time, they're going to be absolutely inundated and flooded. The first kind of version of hopefully a successfully working portal will be that people during their inspection, during their assessments, when they have any other notifications, etc., to raise, will be able to use the portal effectively to send that through. It won't from day one be a constantly open, two-way discussion process where people can upload whatever they want, whenever they want. That is something that CQC were hoping to get to eventually, but that's not going to be there on day one. Hope that's useful. Of course, please do use the chat if you have any other questions that you would like to ask. Question 2. I've got 7 questions so far, by the way. Feel free to add more in the chat section. Question 2. This is a really important one that we hear pretty much every time we go to any kind of open event. What should I do if I am stuck on a requires improvement or inadequate rating? There's lots of ways that this can happen. So someone that got in touch with us a few days ago stated that they have kind of taken over a service and they are stuck on the previous rating that the previous manager and managing group and leadership achieved, and they've made loads of changes, and it's a year, 2 years later, and they've still got that old rating from that old team from the group that used to own the service. Or others, they've had an inspection, it hasn't gone quite the way they had hoped, and now they're just kind of stuck on that rating for 3, 4, 5, maybe even 6 years. Now, there is no easy answer to this in that there is no magic button you can press that summons a CQC inspector to come and do something. I spoke with CQC about what should I tell a service that are in this space, and their first point was to say local authorities would be the best route to getting a CQC inspector to come back out. Now, this implies 2 things. Number 1, that you already have a relationship with local authority. And number 2, the local authority value you enough to kind of get hold of CQC for you. In short, what many providers have found is that, if they do move down to requires improvement or even an adequate rating, that they then are unable to access local authority contracts, local authority placements and care. CQC were very open and said that isn't actually a CQC mandated or legal thing. There is no law or regulation or CQC rule that says if you get an RI, if you get an adequate, local councils must not place people with you, must not allow you to provide their care. There isn't actually a law or regulation that stipulates that, but many councils, because they are in charge and to some extent accountable for the quality of care that they commission, will understandably use things like a good and outstanding to kind of mitigate who they choose to provide and to work in partnership with to provide care. If you have worked really well with your local authority for some time and the assessment doesn't go how you feel and you feel it's incorrect and you feel the local authority wish to continue working with you, then the local authority can just continue to work with you if they want, but equally they are a great route into going through to CQC to ask them to reappraise and reassess the service. So if you have good relationships with local authority, if you have named people that you can speak with, local authority representatives are a great way to reach CQC and kind of have a more robust request to have yourself assessed again. If you don't have that local authority approach, another area of use is what's called the Give Feedback on Care form. If you Google Give Feedback on Care, this is a form that essentially means that anyone can go on, they can find your service, they can write a positive, a negative, or a mixed review, and it will go directly to CQC. Some services have found that as a result of the Give Feedback on Care form, they are able to get quite a lot of feedback through to CQC, which can potentially trigger an inspection. It is true that CQC will often be triggered to inspect as a result of negative feedback. There was one service I did some training for who, half jokingly for about a minute, said, should we put negative reviews on the Give Feedback and Care form just to get their attention and bring them out, which obviously was swiftly disregarded. But certainly the Give Feedback and Care form is another way of getting information to CQC to hopefully raise your profile and potentially generate a new assessment. There is a third thing that I think we have to seriously consider here, which is that if you are stuck on an RI or an adequate rating, we have to think of the filler. Now, one of the things that I think is almost in services advantages is if you got a rating 4 years ago that was a requires improvement, the fact that it was 4 years ago is a great strength. If it was 4 weeks ago, it's going to be quite hard to kind of talk around. If it was 4 years ago, there is nothing wrong with stating to prospective partners, to prospective individuals joining the service and so on and so forth, we have this rating. It's very old. CQC are in the midst of flux and massive changes to their framework, massive changes to the way they're working. And as a result, CQC are very openly stated they haven't inspected as many services as they should. And that's why we are still stuck on this rating. We don't believe this rating reflects where we are at. And then it's about filling in the gap with other independent information. And this is where partnering with independent quality experts, independent auditors, some of the stuff that we do in terms of the feedback surveys and training and so on. There are ways of gathering additional forms of information to make up that gap between the RI that you received and hopefully the next rating that is at some point around the corner. Again, using things like carehome.co.uk ratings or Tumnr. I think we've got, on the one hand, how to kind of encourage a new inspection. We've talked about local authorities, the Give Broken Care form to potentially make that happen. In view of the reality that that's not going to magically result in turning up tomorrow, we need to think about how do we fill that gap. Use the fact that CQC are in the midst of challenge. Use the fact there's been a big framework change. Use the fact CQC have very openly stated they've not done enough inspections over the last year or two to highlight that this assessment is not necessarily accurate to today, particularly an older one, and then fill that gap with more recent independent evidence, whether that is the feedback stuff that we do and feedback survey stuff, whether it be getting independent quality auditors to do an independent inspection or an independent audit. Create and generate additional independent evidence to the quality of your service that is more recent than the RI or the inadequate rating that is hanging over you. So hopefully that's given you a bit of an idea, both in terms of local authority and Give Broken Care, and also what to do in that in-between time as you wait for a new assessment. Really important one. How do I challenge or appeal a rating? I've been looking into this and speaking to others that have done it and so on and so forth. The first thing to highlight is that, this in itself is a challenging process. CQC are not very keen to necessarily make big changes or respond favourably to appeals unless they're argued well. It was something that the Care Provider Alliance, the CPA, in their review of the framework, stated was an issue that CQC, in their view, needs to have an independent body that can appeal and challenge and review ratings. That isn't yet established, that doesn't yet exist, and it may not exist. So what do we do in the meantime? There are two main ways that we can respond to and challenge or appeal a rating. The first, of course, is the factual accuracy check. The factual accuracy check is, and I know you know this, but I want to make a few points on it. The factual accuracy check is the first port of call for you to have any kind of change to what has been written or what has been said, but it is exactly what it says on the tin: factual accuracy. If there are things that are incorrect, things that are clearly mistaken and incorrect facts that you may wish to review or check, the fact accuracy check is there for you. I was having a bit of a read of people that have successfully challenged reports, and one thing that came through was that some services actually use legal teams, they use lawyers, they use other external professionals to help them with that factual accuracy check. You have quite a small window for the FAC. So sometimes if you think about, we've got an inspection, we get the vibe it's not going to go the way we want, we know the report is going to be initially reviewed and sent to us at this time, and that gives us this window of time to use the factual accuracy check. It may be worth considering external support, whether that be legal teams. Literally, there are legal lawyer groups and teams that specifically support services through CQC, or whether it be another form of external provider that can help you with the factual accuracy check. There is value in doing your absolute best with the factual accuracy check and not just doing it on a Saturday evening when you find the time. So think about what resourcing can I put into that factual accuracy check over that time period to make sure that we have got the sharpest response as possible. There is another way after the factual accuracy check, which is that, if a report has been published and so on and so forth, There is what's called a rating review process. This enables you to potentially challenge the way in which the inspection has been done. So you're not saying, it's not this is right, this is wrong, which is the fact accuracy check, nor is it saying, oh, can you look at some more evidence because actually we think this is better. Oh, could you have a look at this because actually we've got some more evidence on this. It's not that either. The rating review process is where you believe the way that CQC and the CQC inspectors have carried out your inspection and your rating and your assessment was incorrect, was out of line with what should be done. Essentially, it's saying they didn't do their job properly. And there's usually around 15 working days for you to do that. Often there is a link that is sent through that you can use to fill out an online form if you want to be considered for a rating review, a rating process review check. What I would say about that is, again, you probably don't want to do it on your own. You'll probably want to have either some legal support or another form of support to ensure that that goes well. It is something that is not around, oh, we had some more evidence we'd like to send to you, or oh, we'd love you to look at this. It's not that. The time for additional evidence is over. What you're doing with that review process is to highlight that things were done erroneously, incorrectly, that the way the inspection, the way the rating and the assessment was carried out was incorrect and unfair. So those are two. You've got your fact and you've got your rating review, your rating process review. Do consider legal or external support for those. Think about what we just talked about earlier about being stuck on an RI. We've worked with services that are stuck on RI or inadequate, they don't feel they deserve, and have been on them for 3, 4, 5, 6 years. So if you're going to do a challenge or an appeal, either via the FAC or the rating review process, bring in the big guns, get some support, bring in a legal team if at all possible, and throw everything in the kitchen sink at that process. I hope this is useful. I hope you're finding some of these questions reflective of some of the thoughts that you've had. Again, feel free to add questions in the chat section as well. Question 4, do I need consent to give staff contact details over to CQC? This is something we have had a lot. So we were sounding the horn about this all the way back in 2023 that CQC are going to want to speak to staff and they're going to collect phone numbers and so on. And then it started happening. And many services have told us that early on in the inspection, or even when they were announced inspections as part of that initial phone call, CQC had asked them to organise the contact details of staff to share with them so they could phone and email staff to find out their experiences of working for you. And this led to many going, well, can I do that? GDPR, can I just send these details off? What's become quite clear is that CQC, kind of the body of CQC, weren't necessarily fully expecting inspectors to go quite so deep with this, and that actually, this was something that perhaps wasn't really formally organised. If you Google it, if you try and find any information around consent and GDPR sharing staff details with CQC, it doesn't really exist because it hasn't been fully considered. We do know of inspectors that have said under regulation so-and-so we have a right. There is some legislation around if CQC believes something is in the public good, that is as part of their public duty, that they may be able to get hold of people and use contact details and receive contact details. And so it comes down to whether speaking to staff fits that bill. What I have always been saying to services is get consent from everyone in terms of, are you willing to speak to CQC? Would you prefer to speak via phone, via email, in person? And then share the details with CQC in line with the permissions that you've received, because fundamentally, you're covered. You are sharing those contact details in line with the permissions you have received from your staff. If CQC then turn around and go, no, we just want all of them. We just want all the phone numbers. We don't care if this person hasn't consented. In the rare situation where that does happen, you then have to either kind of raise that challenge and challenge them to that, or you may wish to provide it with the proviso that they give a written statement to you via email that they have formally requested those details, despite the fact that you initially sending them in line with consents that are given. A few kind of caveats I would say to this. The first is to highlight that this is not something where staff are going to be phoned and emailed several times a day for weeks and weeks and weeks on end and years and years and years on end. This is a one-off kind of unique situation where every few years, maybe 1, maybe 2, often 3, 4, 5 years, there will be a CQC inspection where inspectors want to speak to staff. And I think what we need to do is, as best as possible, provide staff details in a way that is clear, in a way that is in line with the consent to those staff have given. But equally, we don't make this massive thing that we are kind of creating this situation that's kind of going to be constant and continuous. This is a unique situation where over a short period of time, CQC would really like to speak to staff. So what we typically say is get that consent, share the details in line with that consent. If CQC have an issue with that, get them to put it in writing to you first before you share any details. What we have typically said as well is you want to provide those details in a spreadsheet that has the name of the person, their role, the length of time they've worked for the service, and then possibly any other comment. Because you want CQC to, if they are going to speak to staff or phone staff or email staff, you want them to know who it is they're talking to. So they ask questions that make sense for their role, they ask questions that make sense for the length of time they've worked in the service, and they are, where possible, informed of any other issues that might be of relevance. Question 5, on that same theme of speaking to staff, a really important one we've seen a lot. Can staff refuse to speak with CQC? Of course they can. They are not indebted. They are not the property of CQC or you. They do have the right to refuse to speak to CQC. There are 2 things I'd say about this, which is the context. So if CQC call a staff member, number 1, it's going to be on a withheld number. So staff are completely in their right to not answer that call because they don't know who it is. So there is no guarantee that a staff member will actually pick up and speak to that CQC member, and that staff member is obviously not in trouble with CQC for not doing that. That is just the nature of life. Same with emails. They might send out emails to all of the staff. That doesn't mean they sit there with a tick list working out who has and haven't replied and getting those that haven't in trouble. Where it does get more complicated is in person. If CQC goes and speaks to a staff member and a staff member just says no and walks off, that can be a bit awkward. One of the things that we often kind of highlight with some of our care staff CQC confidence training and when we speak to managers and leaders more broadly is that we want to encourage staff to positively approach this for the simple reason that it enables the service to put their best foot forward. If CQC are trying to speak to staff and you've got 105 staff and then you send them an Excel spreadsheet that has 2 phone numbers, it's not going to look great. Similarly, if they call 60 staff members and no one answers, it's not going to look great. Of course, staff are completely within their rights to refuse to speak with CQC or to not respond to the email or to not answer the phone call or to say, I can't speak right now, could I speak with you maybe tomorrow around this time? Of course, they have the right to do that. But I think what we must also ensure is that all of our staff have a fair understanding of what's happening here. So it doesn't become this massive, big, terrifying thing. Actually, this is a professional chat. CQC want to understand what it's like to work for our service. They recognise the value of your experience and they want to have an opportunity to speak with you. It's one of the big things with our care staff confidence training that we do, just to help staff understand that you are not on trial here. You are giving evidence. They want to speak to you as professionals to find out your experiences. So I think alongside this, can staff refuse to speak to CQC, there's a deeper question I think services need to ask themselves, which is, are my staff empowered and supported and encouraged to speak with CQC? Have I created a setup in our service that means that staff are ready to speak with CQC? So yes, of course, staff can refuse, but I think a greater question we also have to ask is, can we ensure our staff are ready to speak with CQC? And how do we ensure that they can do the best that they can and feel as confident as they can as they celebrate the good care they provide? Question 6. Now, this one's one that has come up at various meetings. Some of us here may already know this, and for those who do, that is fine. But if not, I'm doing a quick 2 minutes on this. Question 6. How does the quality statement scoring create a final rating? How does the quality statement scoring create a final rating? There's still been a bit of confusion around this, still been a bit of uncertainty. This is the only example where I've actually got imagery slides to explain this. So here we go. In this example, how do scores create ratings? You've got an example of the SAFE key question. You can see there are 8 quality statements there: learning culture, safe systems, pathways and transitions, safeguarding, etc., etc. And what CQC have done, as we know, is they score between 1 and 4. 4 is outstanding, 3 is good, 2 is RI, 1 is inadequate. And we can see here we've got learning culture 2, safe systems, pathways and transitions 3, and so on. 2, 3, 3, 2, 3, 2, 3, 3. Those are the scores CQC have given for each of those safe quality statements. When we add those all up together, we get a total score of 21. The maximum score that you could have got if you got 4, 4, 4, 4, 4, 4, 4, 4, 4 would have been 32. So in this example here, they've scored 21 out of 32. That is a total score for SAFE of 65.6%. If you jump over to the box on the right, you can see 25 to 38% is inadequate, 39 to 62% is RI, 63 to 87% is good, and over 87% is outstanding. So in this example, they've scored 65%, 65.6% even. They have just scraped in to the good range. So in this example, they've scored each of those quality statements. It's come out in total as 65.6%. That is a good in SAFE. They have got a good rating for SAFE. And then to get your final rating, obviously, they tot up all of the scores. We can see here, SAFE, they've got a 3, which is a good. Effective, in this example, they've got an RI, which is a 2. Caring is a 3, which is a good. Responsive is a 4, which is outstanding. Well-led is a 4, which is outstanding. And then what they'll do, all those key questions are weighted equally. For an overall rating of outstanding, a service will need to have both 2 key questions rated as outstanding and the other key questions rated as good. If the overall rating is to be good, then there are no key questions rated inadequate and no more than 1 key question rated as RI. If you've got 2 or more RIs or 2 or more inadequates, then your rating will be RI or inadequate. And you'll notice this was from 2023. It has not changed. And actually, it was in place prior to the single assessment framework. So that's how we get from the individual quality statement scores to your key question rating: safe, effective, caring, responsive, well-led. And then when we bring safe, effective, caring, responsive, well-led together, these are the rules to create your final score. Right, we have a few more minutes to the last question. And then again, if there's any questions in the chat, I'll have a look at those. When will we know about the next set of updates to the CQC framework? Well, there was an interesting email a couple of weeks ago where CQC essentially outlined their plans now. And in short, the plan is for a modified version of the framework to be rolled out from January. Now, this is not a wham bam mega explosion, everything's changing overnight. This is kind of the first kind of evolution of a rollout of an amended version of the framework. But prior to January, CQC wishes to get feedback on their perceived approach and to get people's responses to it. So they haven't set a specific date, but if we run in the typical ways that CQC work, it will probably be in that kind of September, October time that we would have our first view of what this updated framework would look like, with an aim to then in January start to see that rolled out. So keep our eyes peeled September, October for a then rollout from January. They're not going to be setting the whole thing on fire and chucking it in the bin. What we do know is there's going to be some changes around the number and of quality statements and bring those together. We know that CQC are going to be doing some work around ensuring that people are better qualified, better able to do those professional judgments. We also know that CQC are doing some work around having different frameworks and specific guidance for each sector, which would hopefully mean residential homes versus home care and so on and so forth. There will be some differences in terms of the singleness of the single assessment framework is likely to move to the side. Just a little last bit before we go. If you have any training needs, if your care staff aren't quite confident enough to speak with CQC, we can do that. We have digital resources, but we also have in-person training too. We did one on Monday. It went really, really well. Really great to see staff go from a bit nervous at CQC to confidently explaining how great their service is. We also have CQC training for leadership and management too. So if you are a leader or a manager and you know that your service doesn't really have the strong underpinning understanding of CQC, let us know, we can help. And finally, of course, we have our CQC feedback surveys. 3 out of your 5 evidence categories are feedback. we can run that entire feedback process for you, give you amazing, ready and confident for your CQC inspection, and have all the feedback there to represent you as best you can. Do feel free to get in touch if you need help implementing the CQC framework, if you need training for your staff on how to speak with CQC, training for your management on understanding CQC, or any help around CQC feedback evidence surveys. There is a little QR code there as well if people want to scan that to get in touch, or you can ping us an email, research@careresearch.co.uk. One last point, to see if there's anything in the chat, if there's any questions anyone has raised. Is there a more defined list of what training and recruitment practices CQC require we'll be looking at with the influx of skilled workers? Great question, Emma. Skills for Care have done some really good work on some of the trainings and recruitment practices to share. So do have a look at what Skills for Care have produced around that. Malaya has mentioned what if we're not providing support with local authority? I assume that's to do with if we're stuck on RI inadequate. It's a really good point. It's where I think the Give Feedback and Care form can be a really useful way to raise the profile and perhaps encourage CQC to come and visit. Or secondly, to fill that gap with as much other independent testimony on the quality of the service, whether that's auditors, whether that's groups like ourselves with the feedback, whether that's homecare.co.uk or TUMNA. It may be around filling the gap between now and the next inspection, or perhaps using things like the Give Feedback and Care form to try and generate interest and to bring CQC to you. That is the end of our session. If you see in the meeting chat, there's some information as well. We'll be putting this up on YouTube. And again, you are more than welcome to get in touch with us if you want to ask any other questions, or if you want to email research@careresearch.co.uk. There's also a link if you want to click and book a little Teams meeting, if you want to chat about how we might be able to help you, nice and informal, no pressure, just to see if there are any ways that we can support you. Fantastic. Big thank you to Alison, who has just put into the chat statutory and mandatory training from Skills for Care. I knew they'd done something brilliant on it. If you've got that question around what do we do in terms of statutory and mandatory training, making sure it's as best as it could be, do have a look at that document that Alison has put in the meeting chat. Big well done, and thank you to Alison for sourcing that so quickly and putting it there. That's the end of the official part of today's session. I'm going to hang around if anyone wants to put any questions in the chat. I'm here and very happy to speak with you. Have a great time. Have a great few weeks. As I said, I won't be doing one over August unless CQC do something big and crazy that we need to start talking about. But I will still be around, so I'm sure you'll hear from me, and I'm sure we'll connect via LinkedIn and so on and so forth. But I look forward to seeing you at the next webinar, probably in September, unless CQC do anything big and funky over August. Thanks so much for spending the time. I do hope it was of use and of value, and I really look forward to seeing you all again soon.